All right, hi everybody. We are going to talk a little bit today about PT and pre-PA pathways. We're going to keep it pretty casual as we go through, and I'm hopefully going to click this correctly so we can move on. Oh, this is the hard part.
I think I have to do it.
Okay. All right. So, hello. My name is Maria Martouche Robison. I am a current third-year student in the GVSU PT program. At this point in time, as I'm talking, I am in my 4th out of 5 clinical experiences. There are lots of experiences, and every PT program that you go to is going to be a little bit different in the way they set things up. But one of the benefits, I think, of the GVSU program is that I have slightly smaller clinicals, but I get to see a lot more. So that's why I have 5 experiences. Not everywhere you go will have that. But it's been a really cool process so far. And I attended CMU for undergrads, so they also have a really good program, but with the way life went, this is where I ended up.
And my name is Lauren Parlette, and I'm a current third-year undergraduate student at Grand Valley. And I am studying allied health sciences with an emphasis in pre-physician assistant studies and a minor in biology.
All right, so just a little bit more about me before we talk more about PT. I got married just this last July. I live over in Midland, and I kind of say that because I know a lot of people, when they talk about grad school, they're like, oh my gosh, it's so crazy, there's no time to do anything. There is still time, life still happens, you can still get married and do things with your life, you don't just put it on pause. But I'm originally from Frankenmuth, if you guys know where that's at. It's Christmas and chicken all the time. I love to tell people that my original career interest was actually in high school. I wanted to be a history teacher. I used to tell people that I was going to go to MSU and I was going to get my degree, and then I was going to come back to Frankenmuth and I was going to teach history. That's what I was going to do. And then I tore my ACL in soccer during my high school sophomore year. Just one really bad slide tackle, and next thing you know, I was in PT getting all fixed up and back to ready to go, because I was like, oh, I'm not going to give up soccer. And I went to like a couple different sessions and I thought, wow, you know what? I think physical therapy might be a lot smarter of a decision for me, because I'm not sure how good of a history teacher I would actually be. So I decided to go into that career. I started at 16. I know other people who also, like, not everybody is me, and they know what they want to do at 16. There's actually a couple people in my class right now. One of my best friends, she is now in PT school with me, and she was a dental hygienist for a long time. She's like 31, went back to school, became a PT, so you don't have to be me either, knowing that this is what you want to do. Everybody's a little different, but I do have a passion in running and hiking, but I also have a passion in watching Netflix and eating pizza. So though I'm a physical therapist, I don't exercise all the time, and I really like meeting new people and doing that sort of thing. So PT is kind of a good scenario if you want to be around people all the time. But just a little bit about PT and why you should love it. One of the big things that I think is really cool about PT, like I already kind of talked about even just a little bit, this is my 4th clinical experience, there's a huge variety in the field. So I know for a lot of people, PT, when you think about it, it's just, oh, I hurt my back or I hurt my knee or something, I go get some help and then they make me feel better. But there, you can work like anywhere. So you can work in pediatrics, you could work in the hospital still, you could work in a geriatric setting, so like working in skilled nursing facilities. You can do travel PT, so you can just like travel the country if you want and provide physical therapy services. I mean, it's a huge, broad spectrum. And one of the things I actually didn't know until I got into this career was that you can also work in wounds. So like if you like that kind of stuff, you can also do that. So there's a huge variety in the field, and that's a major plus for PT. But it's also a really great thing because it's a huge supportive community. So getting into PT, I think, is the barrier, that's like the obstacle, that's the thing that's most intimidating. But honestly, every step of the way, you have people who are always on your side. You're never like alone. You've always got students who are there, super supportive. All of my friends are typically students in this program, and there's like a bunch of Facebook groups even. So it's a super awesome community that's like very supportive all the time. But the big thing, and that's why I bolded at the bottom, is if you don't see yourself behind a desk, then this is probably a really good career for you. I personally, when I was going through trying to figure out what I wanted to do, all that kind of stuff, my number one thing was always, I can't see myself behind a desk. I'm not going to be stuck there because I need to move, I need to do stuff. And this is a career where you will very rarely really be sitting down doing anything. You'll always be up and doing something throughout the day. So lots of reasons to love PT. But some of the things that I know are huge concerns and are like the big, ooh, I'm not really sure I really want to go for this, are some of the things I already kind of talked about, and then a couple of the things that I addressed here. So is there any time outside of school for fun? A couple of the little things that I added here, I did get some prerequisites done in high school. So when I got into college, I was purposely able to have a lighter load in undergrad. And that helped a lot because I was able to do lots of things that I wanted to do all the time, like travel and all that kind of stuff. But whether you do that or not, whether you make the decision to do prereqs in high school or not, it's really not anything that's too crazy. You definitely want to spend some time like making sure you focus on your grades or whatever, but there's always time to live your life and do whatever you want. Again, I got married this year, made it happen. I know loads of people who are in the program right now. Any breaks that we have, they travel big adventures and they go out hiking in Arizona, or like they go to Florida or whatever. There's a lot of time outside of school. This is not just what you have to do for your life. So then the next one is it's a 7-year program. Luckily, yes, it's a 7-year program, but you will know if you like it before you even get too far into it because, again, huge variety in the field. So for me personally, I'm not a huge fan of the orthopedic stuff. Even though I tore my ACL and that's where I was in that setting, it's not actually my favorite setting. I like doing other stuff instead, and that's why it's a career that I end up liking so much, because even if I find that there's something I don't like, there's somewhere else that I do like. And then before you even get too deep into the program, you have to do a bunch of job shadowing. So let's say like you think maybe PT is something you want to do, and like your first 2 years of school, you're going through classes and you're doing shadowing and you think, you know what, this is not my favorite thing in the world. Perfect, no big deal. There's no time lost there because you have to do so much job shadowing that you will always have the opportunity to shop around, like I kind of said. And then the last one is it hard to get into school? I'm a couple years into school, so it might be a little bit easier for Lauren to answer that question because that's currently your process right now. I will be honest, it was a very stressful process for me because it's like an intimidating thing. But now that I'm into school and I'm able to reflect back, the things that you really place value on and that you think are very important end up being less important than you might realize. So yeah, like I said, grades are important. Definitely. You want to have a good GPA, all that kind of stuff. But when I say that there are always people helping along the way, I mean like literally there are counselors who will tell you this is what you need for this school, this is what you need for this school. You've got friends who are always there for you. And my little sister is actually going for PA as well. And I like to tell her that for as much as your grade is important, your desire to get into the career and like your motivation, your hard work mean way more than that letter grade, because what they want to see is like your ability to go to work or your ability to volunteer or your interest in job shadowing. There's so much that goes into getting into school. So I just don't want anybody to get stressed out thinking, oh, I have to study so hard all the time and I need to have perfect grades. That's really not, it's huge, but it's not the whole gambit. So a couple things to consider.
Okay, and then a little bit more about me. So I am currently living in Allendale, Michigan, which is where Grand Valley's main campus is, since I am still an undergraduate student. But I am originally from White House, Ohio, which most people, I'm sure, have never heard of it. It's a small town right outside of Toledo, so it's about 3 hours from here. And I also put my original career interest as occupational therapy. And I really wanted to mention this just because, as Maria was saying, this did change for me once I did shadowing. So it kind of stresses the importance of making sure that this is something that you want to do before you get into it. And so for me, after shadowing, I realized I still wanted to do something in healthcare, but I realized that OT was not for me. So I wanted to be able to find a school that had still a wide variety of different healthcare opportunities and options so that I could kind of see what I would like best and still be able to stay at the same school. And Grand Valley has so many different healthcare majors and programs, so I eventually settled on coming to Grand Valley and came across PA, and I'll talk about that a little bit more in a bit, but of specifically why I liked the PA profession. But after going to the pre-PA club, I decided that this was the best fit for me. So a little bit about in terms of what I do currently. I am in the Honors College at Grand Valley, so I'm also a mentor for incoming freshmen. We have a whole incoming freshman program the first week that as they come in, which is a really good opportunity, good leadership building skills. And then I also this year became a mentor for the pre-PA club. So I have one mentee, she's a freshman, so I'm just kind of helping her start the process as I'm getting ready to apply. I'm also a student ambassador on campus, so I volunteer to lead tours around campus and sit in on student panels, things like that. This year, my friends and I restarted the Rotaract Club here at Grand Valley. So it's a volunteer-based organization. We plan different service learning projects in the community. And so I'm the treasurer for that. And then I also like to be involved in Habitat for Humanity. And this semester, I am a teaching assistant for physiology. And then just in terms of some of my interests and passions, I love playing tennis. I played all throughout high school. Still like to play occasionally, but not as much as I used to, which I definitely miss, so I need to get back into it. And then I also love volunteering. As you saw in my involvement, there's a few things there. I also like to volunteer for a few different organizations in Grand Rapids. The Community Food Club downtown is a great one. Meals on Wheels, Kids Food Basket, things like that. And then, of course, spending time with my family and friends whenever I'm not doing all these things. And then why you should love PA. So there's so many reasons why I originally got into this. So first I want to talk about the lateral mobility. So the PA profession is very similar to nurse practitioner. And the kind of difference is, well, PAs are trained on the medical model, and then they have lateral mobility, I mean in terms of they have freedom to move around to different specialties. So you receive kind of an inclusive training that allows you to work in any medical area. So that was something that I was really interested in because at the point that I'm at now, I'm not set on where exactly I want to work. And through shadowing and clinicals, I will, I'm sure, figure out where exactly I want to work. But this also gives the opportunity to change it up, and this helps to prevent burnout and things of that nature that basically give you a taste of everything, which is kind of why I like the PA profession too, because there's so many different things that you can do with it. And then kind of going off of that, relationship building is great in this profession because you spend so much time with patients, listening to your patients, really building trust and relationships with them. And that's something that I'm really interested in. As of now, I'm thinking about going into family practice, which, like I said before, because of the lateral mobility, I have so many different options to do that as well. But in PA professions, you just get to really build relationships with your patients and then also with your coworkers, which is what kind of the whole purpose of this interprofessional education is. So the PA profession is very team-based, which is something that I really love. I realized how important teamwork is in healthcare after I started working as a nursing assistant in a nursing home. It really taught me that all careers in the health profession are important and you need them all to provide the best care. So if you like working with people, any career in the healthcare profession, any career in healthcare is good for you. But PAs definitely are very team-based, but then they're also very autonomous, which is great. You know, I feel like people have the connotation that PAs always work under a supervising position, which is true, but also nowadays they're becoming very autonomous and you can provide your own individual care as well. And then another reason why the PA profession is great is it's a fairly short program. After 4 years of undergrad, it's anywhere from 24 to 28 months. So just a little bit over 2 years, which I thought was a good length for me. I don't want to spend too long in school. I'm ready to get out and start working and helping people. So that was why this was a good fit for me. And then also the job market, as I'm sure, I feel like in the past, not a lot of people had heard about PAs, but now they're becoming more and more common. They're actually expected to grow 31% from 2019 to 2029, which is faster than I feel like the average for most occupations. And then also this profession just gives you a good work-life balance as well, which is important for me. And then some other main questions and concerns, like Maria was talking about for PT. My first thing that I wanted to include was just some general tips for students who decide to go into the pre-PA profession. So my first one on here is study, which, as Maria was saying, is very important. Your GPA is a very important aspect of getting into PA school. And I do try to tell myself that it's not the only important thing. Like I will get into later on here with the well-rounded application. And it is easier said than done. It is a very stressful process, as she was saying. But I try to tell myself that if this is what you want to do, whether it's PA, PT, you will get there eventually if that's really what you want to do. So it may take a couple tries applying. There'll definitely be ups and downs along the way. But overall, I feel like the main things to focus on, of course, grades. I also say that it's really important to get involved in the community and find leadership opportunities because, again, not everything is about your grades as well. So you want to be a well-rounded applicant and have experience doing things that aren't healthcare related as well. I remember I used to think that the volunteering I had to do had to be in a hospital or related to healthcare, but they really want to see that you can do everything basically. And of course, having leadership skills are just very important in any healthcare profession, just with the amount of communication that you have with patients and coworkers. And then another important thing about applying to PA school is having experience working with patients. And so for me, this has been one of the more difficult aspects of it because as a student without a degree, it can be hard to get a healthcare job. So I feel like the most common thing that people do is nursing assistant. You can also become an EMT, phlebotomist, medical assistant. I personally am a nursing assistant. I took a 2-week nursing class and took a state test, got certified as a nursing assistant, and I worked in a nursing home and a hospital doing that. And depending on the scenarios, the conditions that you work in, some people, it's not the most ideal job, but it definitely has taught me a lot that I'll be able to use when applying in interviews and as a future PA. But overall, like no matter what you do, it's really important just to be yourself and stand out and also have fun with the process. Like I said, it is very stressful, but it's all worth it in the end, hopefully. I'm applying this year, so we'll see. But and then kind of going off of what I said, so some other questions, a lot of people say, what if I don't have all A's, or what if I don't have enough patient care experience? And like I said before, it's just important to have a very well-rounded application. So if your application is weak in one area, strengthen it in another. So just kind of doing as much as you can to not just be focused on grades, not just be focused on getting hours, kind of a little bit of everything. And then again, I kind of touched on this, but how do you know where you want to work? Shadowing is a big one, especially for you all as high school students. That's something you can start figuring out now. Shadowing, if healthcare is something you're interested in, start shadowing different professions and see like if this is something that you can picture yourself doing. And then also clinical rotations once you get into a program. So that's something that I'm looking forward to. Is all programs have a set number of rotations that you do in specific areas, and then most schools allow a few electives where you get to pick specific areas that you want to work in. So overall, it's very flexible. There's a lot of variety, and you're bound to find something that you enjoy.
All right, so then just like the last little bit that we're going to talk about, obviously we both kind of talked about it, and I think Lauren really touched on it a lot, was just this idea of teamwork. So IPE stands for Interprofessional Education. I think we're both in this program, right, Lauren? You're in it as well? Okay, I thought so. So pretty much it's just us working on our skills because, you know, nobody is expected to be perfect. So we're all having opportunities to work on our communication skills and our teamwork skills, and also just getting to know each other's professions and understand what's going on. So just the importance of that, especially since I've been in some clinicals now, is teamwork makes the dream work. It really, really does make the dream work. You can't have all the answers, and that's why you need the team. You're not supposed to have all the answers. So if you can rely on your team, then you're going to be a lot more successful in providing really great patient care.
And then another big thing that's important about IPE is preventing and avoiding burnout, which I kind of touched on earlier. But in terms of IPE, it's important that, like Maria just said, that you know not only your role, but also what other people do. Because then you're not taking on too much unnecessary responsibility. You know, you can't completely solve a problem or treat a patient with just yourself. You need to be able to talk to other professions and see how you can all work together to come up with the best treatment. So overall, just making sure that you ask for help when you need it, because that will help eliminate unnecessary stress and thus avoid burnout in the end.
And then it also just helps with general communication and like happiness at work, just in the sense that you are working with professionals in a professional environment, and things get very stressful sometimes. And if you don't really know what your fellow coworkers' role is at work, or if you don't really feel comfortable talking to them because you don't really know if that's in their wheelhouse of things that they're doing, then it's going to make it really hard for you to appropriately talk to people, and it's going to make it really hard for you to be happy. I know for me, like in my last clinical, I was working in the hospital actually, and one of the best ways to make my day at work better was to always go talk to my nurses or my doctors or whoever was there first and get a rundown. Okay, what's going on with your patient today, blah blah blah. And then afterward I would go talk to them again and tell them how the session went and blah blah blah. And it, even though it didn't change necessarily patient care all that much, it did really, really change how I felt with my coworkers, how I felt they perceived me, and then overall help with my skill in being able to be comfortable in the future with new people and new professions, and then just generally feel confident in my own thought process and abilities as I went through.
True.
But, yeah. So I think that is that for us. Hopefully that kind of addresses a couple things for you guys. If you have any questions, then you can definitely email us at any time. Obviously, in a short little ditty presentation like this, we can only say so much and give you so much advice.
But yeah, anytime if any of you have any questions about either our professions or IPE in general, feel free to email at any time. It's not a bother at all. But yeah, thank you guys for listening.
Thanks.